I now invite the President of the Bombay Psychiatric Society, Dr. Shobha Nair, Madam, to please welcome the audience.
Good morning, Bombay Psychiatric Society. A very warm welcome to our guest speakers, chairpersons. Are our guests from IPS reached here? If they are soon going to reach. So Dr. Abhay Matkar and Dr. O.P. Yeah, he's here. Welcome, Dr. Abhay Matkar, and also Dr. O.P. Singh was to come here. So I welcome him as well. Senior members of Bombay Psychiatric Society, teachers, colleagues, and my dear friends. As organizers of this CME, I cannot express how happy I feel to see at least about 60-70 people here in the hall who have braved the rains and managed to reach here. But we have just now shared a link on both the life member group as well as the life associate member group so that they can watch the CME live in case they cannot reach here because of the inclement weather. So in case you all have your friends who wanted to join us today but are not able to make it, please inform them that the link has been sent on both the groups and they can just watch it live. And once the rains abate, they can come down to have lunch. So a very warm welcome to all of you. Before I give an overview of today's CME, I would like to give a brief update on the activities so far after the new committee took over in April. I'm sorry. Can I just shut everything? I'm sorry for the, I think I'm inadvertently pressing something over here. So as you're aware, it's your inputs and suggestions which have driven our programs through our online surveys and meetings which we had with faculty of all the medical colleges. That's how we then said ki we will organize programs, and we have focused on skill building, and we have had a tremendous response to the 3 skill-based workshops that we had in the medical college. 4 webinars, 3 of which had faculty from the UK sharing their perspectives along with the Indian speakers who shared our perspective. It was an excellent mutual exchange, which was again very well attended. I'm grateful to Professor Alka Ahuja, my MBBS batchmate and alumnus of KEM Hospital, who is now the Vice President of Royal College of Psychiatry, Wales, and the chair at RC Psych Wales, whose efforts and enthusiasm led to a collaboration between Royal College of Psychiatry, Wales and Bombay Psychiatric Society. It's a first of its kind endeavor for us. So I'm very happy that we have started off with the first webinar, which was a case-based discussion in child psychiatry, and we had a phenomenal attendance of about 155 participants, and we have kept the themes in such a way that it is actually it is sharing of ideas and sharing of learning between the 2 countries. So we look forward to many more such webinars in the coming years. We conducted the undergraduate and the postgraduate intercollegiate quizzes, this time separately with a lot of fanfare with added lectures, and I must appreciate the efforts of Dr. Rashmi Singh and Dr. Somil Savla for conducting a very novel and exemplary intercollegiate, postgraduate and UG quizzes, which had more than 7 to 8 teams from different colleges participating. Now this is the Diamond Jubilee year of Bombay Psychiatric Society. It is 60 years since its inception, and it's a proud moment for all of us as we announce that we have had 77 new members in a short span of about 6 months who have joined our family since April 2025. We will be welcoming all those who have consented to come on stage during the course of today's program. Coming to the midterm CME, as Dr. Prajakta mentioned, we enthusiastically started a new initiative with suggestions received from the faculty to have a free oral and poster presentation session. The response was quite damp, but we are not going to give up, and we'll announce it much earlier next year, and I hope that this will turn into a platform for not just PGs, but I feel clinical psychologists, so psychiatric social workers, all our LAM members as well as senior LM life members can present their interesting case series, present their work on this platform. Mumbai lacked such a platform because we had only award papers for the annual day. So what is in store for us today? Distress versus disorder. Utility of our classificatory system. Does it result in overdiagnosis of psychiatric disorders purely based on symptoms? When we studied, DSM-4 at least had the multi-axial system, so there was some context to the axis 1 diagnosis. We gave an axis 3 and an axis 4, which gave us the context in which the axis 1 was happening. But DSM-5 doesn't even have that. So these are contentious or debatable issues which I am sure many of us have been thinking about in our field, especially when we see a lot of patients who come to us because of distress secondary to their psychosocial stressors. So this has been a topic close to my heart, and as I was just seeing who has been, trying to read publications on this topic, that's when I came across this excellent article by Jacob Sir. And I also happened to watch one of his lectures on YouTube, and that's how I approached Sir and asked him to talk on a subject on which he has given a lot of thought and work, and it's exemplary work. So we are very, very honored, Sir, that you have come all the way from Vellore to share your thoughts on this very pertinent subject. And I feel the audience should take this opportunity to learn from what his views are and to clarify any doubts and ask him questions. BPS welcomes you, sir, to this gathering. May I request Pooja and Dr. Swarup Bhatankar and Pooja Kapri to please welcome sir. Can you please go up to where sir is sitting? These are flowers made by Autism Dynamic Intervention School, which is being run at Nair Hospital. So the teachers, with the supervision and help of the teachers, students make these flowers. So we are in an era where propagation of misinformation, bias, fake news is easy. And I'm sure all of us agree that there is a need to sift science from pseudoscience. I'm grateful to Professor Arnab Bhattacharya, Director, Homi Bhabha Center for Science Education, TIFR, for accepting our invitation despite his extremely busy schedule to talk on scientific temper in the age of artificial intelligence. I would like to share here that Professor Bhattacharya has been a very empathetic leader, and we have had several interactions with him when some of the employees working under him has been our patients, and he has always supported employees with mental illness, helping them grow and reach their potential under his wings. A very warm welcome to you, sir. Severe mental illness and disability have been topics, once again, close to my heart. We understand the limitations of pharmacotherapy, and it is rehabilitation only that truly reintegrates persons with mental illness back into the society and helps them lead life with dignity. Can Mumbai, a metro city, adopt any particular model for rehabilitation? Can Bombay Psychiatric Society aid in some way? These are some questions I have been pondering over, and that has resulted in the next session on the road to reform, wherein we have Dr. Hamid Dabolkar from Satara, who has devoted his practice to community-based rehabilitation, and we have Dr. Ashish Kute from Nagpur Mental Hospital, who will share insights of rehabilitation and the halfway home that is run there. I'm sure their talks will inspire many of us to do something more in this city. Dr. Hamid is unfortunately down with dengue, but he has graciously agreed to deliver his talk despite his illness online. And so we will have his interaction online and learn the challenges that he has faced and the reach that he has been, the outreach that he has been able to make in the difference of so many people's lives. I